As a concert pianist, David Ehrlich can't risk hurting his wrists. So he was anxious when a cardiologist took an emergency look at his diseased heart with a catheter, not through the groin as he expected, but with a small wire that entered through an artery in his wrist.
Shouldn't feel anything else.
And how did that affect his playing?
Zero. Absolutely not at all.
Miss Gordon, I'm going to give you some numbing injections here, okay? You may feel a little burning.
Dr. Ramesh Mazhari is one of the very few American doctors who prefer heart catheterization through the wrist.
Slight pressure going in.
Most doctors do it through a much larger femoral artery deep inside your groin. Dr. Mazhari thinks the radial artery in the wrist is better.
It is safer and it is more comfortable for the patients. Here you see the catheter entering the common femoral artery.
TV medical shows make unblocking clogged arteries appear safe and routine. After all, doctors do 1 million of them each year, but they are not risk-free.
One of the most feared complications of doing an angiogram using the femoral artery is the bleeding complication. Bleeding can be very serious sometimes. Some patients will require blood transfusion, and it could be fatal.
No, it's fine. I can just get on the other side.
The other issue is patient comfort.
If you're not sleepy enough, let me know.
Okay.
Okay?
I just don't want to feel pain.
We don't want you to feel pain.
Elvia Gordon will get her catheterization through her larger femoral artery. She won't feel pain, but the recovery will take a while. And she can't move for a half day afterward to ensure the artery stays closed.
No tenderness, no pain. We have one more hour of this, and then we can gradually get you out of the bed. The advantage of this approach is that right after the procedure you can sit up and walk around.
Mary Lynch got her catheterization through the smaller radial artery in the wrist.
The sheath is out, the balloon is fully inflated.
The recovery was so fast, she was up and smiling immediately after surgery.
I'm ready to go home. I feel good. I don't have it. There's no pain. Doing the surgery, I could just feel a doctor's hand on mine, but I didn't feel anything else.
Cardiologists wanted to know the difference between the two procedures, so they studied hundreds of patients. And what they found was remarkable. Nearly 60% fewer bleeding complications when they went in through the wrist.
With the radial approach, we're using a much smaller artery that's very close to the surface. It's very easy to compress, and the risk of bleeding is minimal.
While going in through the wrist is more comfortable and has a quicker recovery, it's not always the best way straight to the heart. If you've already had bypass surgery, it's often safer to use the femoral artery through the groin. Doctors recommend kidney patients use the femoral too, and going in through the wrist takes a lot more practice.
Using a radial artery could be very challenging. There are anatomic variations that are unexpected, and you just have to learn the new techniques and tricks to overcome the obstacles.
And in the cath lab, time is money.
It took me almost 100 cases before I felt very comfortable doing this procedure. Physicians are very comfortable doing the procedure using the femoral artery, and they are reluctant to learn a new technique.
Some patients wish they would. Mary Lynch's doctor discovered severe blockages and will be back for bypass surgery. But this quick trip to her heart may have saved her life.
I think it's a second chance at life, it is. So I get it done, go home, get back to real life.
And our concert pianist? His wrists are fine, as well as his heart. The catheterization discovered blocked arteries, and a bypass operation is keeping him playing concert halls into his 70s. David offers his doctor a heartfelt thank you. In Washington, I'm Andy Field for My Generation.